The Tampa Bay Birth Network is an organization of families, professionals, and individuals who support pregnancy, birth, and parenting as normal and natural processes. Our events provide information and resources to help empower expectant couples. The Tampa Bay Birth Network is a Florida non-for-profit organization and federal 501c3 made up of professionals and individuals who support the natural processes of pregnancy, birth, and parenting. This year's Natural Birth and Baby Expo was hosted by Corbett Preparatory School of IDS in Tampa, Florida. To find out more, please visit www.tampabaybirthnetwork.org.
For 5 years, and over the last 4 years is focused on breastfeeding, genital integrity, and evidence-based birth. She's a doula, certified lactation counselor, placenta encapsulator, and genital autonomy educator. She has 3 children, 5 that are 5 and under, and that she's raising with an attachment parenting lifestyle. And please give a warm welcome to Lauren.
Thank you. I'm excited to be able to speak today. I have a short video that we're going to play in the beginning. I also have a couple of binders that I'm going to pass around. There is some graphic material in the binders. I didn't really include anything graphic on the presentation just because of little eyes. So if you want to take a peek at the binders and it gets a little bit more into the nitty-gritty of what actually happens during male genital mutilation. There's also a book that has a list of intact celebrities because everybody's all, ew, foreskin is gross. But then we turn around and we oogle over these men that we do not think are gross. So I will pass that book around as well so you guys can kind of look through that and realize how normal foreskin is. So I'm going to go on and get those going and we'll watch the video. Realize and understand that female genital mutilation or female circumcision is a barbaric practice. We think of tribes over in Africa and women and men forcibly holding down unconsenting girls and cutting off parts of their foreskin, their clitoral hood or their labia minora or major. And we think, oh my goodness, why do we allow this to happen? But in America, we routinely strap down our boys and do the same thing to them. Out of 100 boys that are circumcised, 75 will not readily breastfeed post-op. 55 will have an adverse reaction from the surgery. 35 will have post-op hemorrhaging to one degree or another. 31 will develop meatal ulcers. 10 will need to have the circumcision surgery repeated to fix prior surgical problems or an error. 8 will suffer infection at the surgical site. 2 will have a more serious complication, either seizure, heart attack, stroke, loss of penis, or even death. 1 will require additional immediate surgery and sutures to stop a hemorrhage. 1 will develop fibrosis. 1 will develop phimosis. 1 will be treated with a urinary tract infection. 1 will be treated with antibiotics for surgical site infection. And of those boys that do receive pain medication for the surgery, which is only about 4% of boys in the United States, some will have adverse reactions to the pain medication injected. Out of 100 intact boys, 1 will be treated with antibiotics for a UTI, and the number is actually less if the boy is never forcibly retracted. And 1 will be told to be cut later in life for one reason or another. Fewer, yet again, if the foreskin is never forcibly retracted. 117 baby boys die every single year from circumcision-related complications in America. That's 1 boy every 3 days dies from an unnecessary cosmetic procedure. This is a little boy laying in a circumstraint with the doctor performing. It is edited out, but he's lucky enough to have his hands free. Most of the time, they strap their hands and their legs down. If you were to strap an unconsenting adult down like this and take any type of sharp instrument to their genitalia, it would be considered sexual assault. What makes our children any different? We are growing beautiful children inside of us if we're women. We're fathering beautiful children on the outside if we're men. Nothing in a mother's gut will allow her child to be harmed. And a lot of people think that there are amazing benefits to circumcision when in fact there aren't. You know how to protect your babies, moms. You know how to grow them, you know how to feed them, you know how to nurture them. Do not welcome them into the world 2 days later by strapping them down and forcibly removing part of their genitalia, which has quite a few functions and has a very important meaning, not only as a child, but as the man that they will become. Physicians should not prescribe, or seek compensation for medical services that they know are unnecessary, which is in the American Medical Association Code of Ethics, it's opinion 219. Routine infant circumcision is not a necessary surgery, and it clearly violates this code of ethics. However, we continue to ignore the fact, and doctors continue to offer it on a regular basis. This is a history of circumcision in America. It's quite interesting. There's a lot of quack stuff behind it. In 1830, they thought that it would cure wet dreams. Kellogg, in about the 1840s, said that it would stop masturbation. They thought it cured epilepsy, it cures spinal paralysis, that it would cure bedwetting. Dr. Louis Seri claimed that foreskin causes paralysis of the bladder and curvature of the spine. They thought it cured blindness, deafness, and mental retardation. And again, John Kellogg promotes circumcision, male and female, as punishment for masturbation. They also said that it would prevent blacks from raping whites. And it was mass implementation was right around the very early 1900s, like 1902, 1903. They also thought that it cures tuberculosis. And at that point, since there was a large TB outbreak, they just decided that they were really going to hit hardcore with trying to strap our baby boys down. In the 20s, they thought that it prevented penile cancer, that it prevents venereal disease and cancer of the tongue, because we all know that our tongue has absolutely something to do with our genitalia in location to our bodies, that it prevents mental illness. There was a study that is completely flawed in the late 80s, early 90s that came out, done in Africa, saying that it actually prevents AIDS and that it prevents urinary tract infections. And every single one of these is obviously false. There are no benefits to male circumcision. John Harvey Kellogg, yes, the cereal guy. His brother said on females that the application of pure carbolic acid or phenol to the clitoris is an excellent means of allaying the abnormal excitement. AKA, it wouldn't make women sexually aroused if we performed a female circumcision on them. On boys, he said a remedy which is almost always successful in small boys is circumcision, especially when there is a degree of phimosis. The operation should be performed by a surgeon without administering any anesthetic, as the brief pain attending the operation will have a salutary effect upon the mind, especially if it be connected with the idea of punishment. He thought that if you performed the procedure without anesthesia, that it would permanently imprint on the brain that sexual gratification, whether it was self or with a partner, would be painful, and it would deter boys from doing it. Well, in this time, people were not as open as they are now, and they didn't want any of that going on, so they blindly consented without anesthesia. The 16 functions of the foreskin. There's erotic pleasure, especially via the ridged band and the Meissner corpuscles. It acts as a rolling bearing during intercourse and masturbation, prevents Dyspareunia, painful intercourse. It stimulates partners' genitalia, providing erotic pleasure. Supplies skin to cover the shaft during erections while preventing tightness. Stores pheromones and release of them on arousal. Stores release and helps distribute natural lubricants, smegma, and pre-ejaculatory fluid. Provides a seal against the vaginal wall to contain semen. Prevents the glands from drying out, which is keratinization, and keeps it soft and moist. Protects the thin skin glands from injury. Protects the nerves of the glands and their erotic functions. In infancy, it protects the urethra against contamination, UTIs, and metal stenosis, which is the narrowing of the actual urethra opening where the urine exits the body from. It's pigmented. It protects the unpigmented glands to sunburn. Protects the glands from frostbite and other weather-related condition. And it makes the glands a visual signal of sexual arousal. In an uncircumcised male, or an intact male, because you can't uncircumcise somebody, so they're intact, the head of the penis is actually a pink color, and it kind of looks like a bullseye, kind of like our breasts looks like a bullseye. It's made to draw your eye to it, for it to be kind of like a, hey, look at me. These are the functions lost to male circumcision. You lose the apocrine glands, blood vessels, the dartos fossata, dorsal nerves, estrogen receptors, Freenar band, frenulum, immunological system, Langerhans cells, length and circumference. Yeah, length and circumference, because when you alter the form, you alter the function. You're cutting away part of a male's genitalia. What man wants a smaller penis when they're an adult? Up to a third of it is lost when you circumcise a male. Lymphatic vessels, Meissner corpuscles, mobile skin, gliding action, natural glands, coloration, penile sensitivity, and sebaceous glands are all lost. The foreskin compromises roughly 50% and sometimes more of the mobile skin system of the penis. If unfolded and separated out flat, the average adult foreskin will measure about 15 square inches, which is the size of a 3x5 index card or the size of a prescription pad from a doctor. This highly specialized tissue normally covers the glands, and it protects from abrasions, drying, callousing, and contaminants. We're going to go over complications. This is from Stanford School of Medicine. A lot of the information people ask, well, do you have unbiased sources? Is this just from some blog that somebody decided they were going to write? Is it, legitimate medical information? This is from Stanford, so it's pretty unbiased. With any surgery, it is important to know what complications are possible. Not only does this knowledge guide techniques to minimize the possibility of poor outcome, but it also allows for more informed discussion with parents who are considering circumcision for their son, as well as permitting improved recognition of problems if and or where they occur. Potential complications of infant circumcision: bleeding, infection, excessive foreskin removed. There's no cut here mark on a brand new baby's penis. There's not. Adhesions, skin bridges, abnormal healing, metitis, metal stenosis, urinary retention, Cordy, hypospadiasia, which is where the urethra opening is actually in the wrong location. Espadiasis, fistulas, I'm not going to even attempt to butcher that one, sorry guys. It's a fistula of the urethra. Necrosis of the penis, amputation of the glands, and death. The necrosis happens most commonly with the plastibell, which is one of the more popular techniques that they use these days. They put the infant's foreskin is fused to the glands like a fingernail. So they have to get under there. So they rip, clamp, crush, and basically destroy the tip of the foreskin without anesthesia, rip it apart, and then they place a little plastic bell on it. The skin under that bell is cut, and it actually rots off. So you have a newborn infant trying to establish breastfeeding that turns around and now has a open bleeding and now dying skin wound in their dirty diaper, because all surgeons recommend that you sit in urine and fecal soaked surgical bandage post-op, which is exactly what we're asking them to do. And those are normal complications. You know, some of them end up very common adhesions. The foreskin is attempting to grow back. The body is so miraculous that it's trying to regrow what it was lost. So adhesions are very, very common. And the answer to an adhesion from a doctor is, oh, well, it's sticking, so let's rip it again with no anesthesia, which does further harm to a boy who's already been through enough traumatic process for the beginning of their life. The complications of not circumcising an infant are absolutely none. There's no complications if you do not circumcise an infant, providing the foreskin is correctly cared for and not forcibly retracted. And I cannot stress that enough, because doctors will be like, oh, well, we just have to check. And your answer as a mom to protect your baby is, no, you're not touching my son's penis. If they need to check for descended testicles, different location, nowhere near the head of the penis. There's no reason for a doctor to be touching the head of your son's penis, just like there would be no reason for a doctor to be putting any instruments, fingers, or anything like that in your daughter's vaginal opening. There's no reason for them to be anywhere near there. Let's go over some myths and some facts, because there's a lot of things, as you saw on the slide before, about the evolution of circumcision, that people have these misconceptions. And thankfully, all of them are very, very, very easily debunked with some very simple common sense. Myth is it's just a little slip, like it's getting his fingernails trimmed. Circumcision is not a snip. The foreskin is crimped, torn, cut, crushed, and sliced off in that order, with no pain medication, and it takes several minutes to complete, and once complete, removes at least 50% of the penile skin, along with all of the anatomy and everything else that it's taking away. Myth, babies don't feel pain. This one, male or female, they do the heel prick, they scream. If you're opting for vaccinations, they scream. You drop them. Don't drop them, but they hurt. Babies are actually able to feel pain at about 30 weeks in pregnancy, because their central nervous system is fully developed at that point. The pain receptors are present throughout the infant's entire body at birth. Babies do indeed feel pain, and actually there are studies out now that are showing that babies actually have a heightened sense of pain. So if you wouldn't do this to a consenting adult male who has proper pain management and proper anesthetic, why are we asking a brand new baby boy to go through the same procedure? Even if it's painful, the baby won't remember it. The body is a historical repository and remembers everything. The intense pain of circumcision causes a rewiring of the baby's brain so that he will be more sensitive to pain later in life. Circumcision also can cause post-traumatic stress disorder, depression, anger, low self-esteem, and problems with intimacy. All of those are pretty straightforward. While the baby's going through it, it definitely imprints on a brand new brain the sensation of pain. Babies don't die from circumcision, it's just a simple snip. Or you had a bad doctor that didn't know what they were doing. You should have chosen a different doctor. The circumcision surgery, which is not just a simple snip, not only damages or maims the genitals of infants and the men they eventually become, it can also and does kill some of them. An average of 117 male infants die every year in the United States from circumcision-related complications. That's one baby every 3 days that dies from a cosmetic procedure that is completely unnecessary. have to get the babies circumcised because it's really hard to keep a baby's penis clean. How many of us have girls? How many of us have tried to clean that wonderful meconium or breastfed poo out of a girl? Yeah. In babies, the foreskin is completely fused. You cannot and should not retract it to clean it, as this would cause the child pain and is akin to trying to clean the inside of a baby girl's vagina. The infant foreskin is perfectly designed to protect the head of the penis and keeps fecal matter out. All you have to do is wipe the outside of the penis like a finger. It is harder to keep a circumcised baby's penis clean because you have to carefully clean around the wound, making sure that there's no feces to get in the wound, and apply ointment. And if they have plastibell, you have to make sure that there's no feces inside of the bell. The foreskin separates and retracts on its own sometime between the age of 3 and puberty. Sometimes it never retracts completely. And if the man is comfortable with that, then they don't need anything done. And if the man is not comfortable with that, there's non-surgical options to help fix the retraction. After it retracts on its own, it will get cleaned during the boys' shower or bath. How many of us have watched our kids play in the tub? It's like an extra toy down there. So there is no reason not to teach them to gently pull back their skin and just water. That's all. No soap, because we wouldn't put soap up our vaginas to clean us out, so you don't need to put soap on them. It actually messes up the pH and everything else just like it does for us. And there's absolutely nothing special that a parent needs to do. Circumcision protects against HIV, AIDS, and STDs. Facts. The adult foreskin, even when fully retractable, still offers protection. The opening of the urethra is protected by the foreskin. The United States has the highest rate of routine infant circumcision. It also has the highest rate of AIDS and HIV. If circumcision did offer protection from STDs, these numbers would be significantly reversed. In nations where routine infant circumcision is rare, so are STDs. Bonus fact. The United States also consumes the most Viagra of any nation in the world, according to Pfizer's own figures. Why? Because circumcision does cause erectile dysfunction. Again, in nations where circumcision is rare, so is Viagra sales. And actually, if you really want to get into it, you can look at the benefits of the Langerhans cells and AIDS. They're actually finding out and making a correlation that these cells that are located within the foreskin actually can protect from AIDS. Also, HIV, AIDS, and STDs, the easiest way to prevent them is a condom. You don't need to cut your baby boy. Just teach them when they're old enough to have and practice safe sex. All males should be circumcised as infants because they'll end up getting circumcised as adults anyway. The need for adult male to get circumcised is extremely, extremely, extremely rare. A study conducted in Finland, a European country with an infant circumcision rate of 0, stated that only 1 in 16,667 males will actually need a genuine medical circumcision. And at that point, it doesn't even remove the entire foreskin. My son was diagnosed with phimosis. I know I've said it a couple times already. And so he had to be circumcised. Phimosis means that the foreskin will not retract. Since children's foreskins are naturally not retractable, it is impossible to diagnose a child with phimosis. It can't be done. Any such diagnoses in infants are based on misinformation and are often made in order to secure insurance coverage of circumcision in states which routine infant circumcision is no longer covered. 18 states do not cover infant male circumcision with state-issued healthcare benefits. They consider it a cosmetic procedure. So if they're giving out a diagnosis such as phimosis, the insurance company will turn around because they haven't done their research to know that the doctor's just trying to obtain insurance funds. Even some adult men have foreskins that do not retract, but as long as it doesn't interfere with sexual intercourse, it is no problem at all, as urination itself cleans the inside of the foreskin because your urine is sterile as it's leaving the body. You might see some ballooning in an intact child or an intact male that is not retractable, and that's normal too. It's literally just the urine coming back up and around and working its way, cleaning everything out. Phimosis can also be treated conservatively with a steroid cream, gentle stretching done by the man himself if he wanted to, or at worst, it's actually just a slit on the foreskin rather than a total circumcision. And these treatment decisions can and should be made by the adult consenting man. This one's kind of long. I'll just basically give you the synopsis of it. There's a circumcision study that ended early due to infant trauma. It was done in '97, so it's kind of older, but the majority of baby boys in the United States that go under the knife without anesthesia still in this day. Basically, this study said that they were trying to figure out which type of anesthesia was the most effective on newborns. They got through 11 male newborns without anesthesia in Canada and said, we can't do this. We cannot do this anymore. This is a barbaric practice, and we have to stop. So they stopped the study immediately, realizing the pain and the trauma that they were putting the boys through with no anesthesia. But yet, still, only 4% of boys this day in America actually have adequate anesthesia, and even then, it's not always effective. The Bible says that we need to circumcise boys. A biblical circumcision is a much different procedure than the one we know today. In biblical times, circumcision involved either just a prick on the tip of the foreskin, just to draw a single drop of blood as a blood covenant, or a small incision of the foreskin that did not remove any tissue. Later, circumcision became removal of a small piece of the foreskin of male adults, and most people still would not be able to tell the male was actually circumcised. The procedure that we know today was actually perfected by Dr. Kellogg as a way to curb masturbation and hinder other sexual pleasure. Lastly, the Bible actually forbids circumcision, and you can look in Galatians 5:2-4, Galatians 6:12-15, 1 Corinthians 7:18 and 19, Acts 15:1 and 2, and Philippians 3:2. And I know a lot of Christians feel that they are doing what they're supposed to be doing. However, those are just some of the verses that state that Christians are actually not supposed to circumcise their boys. Extra fun fact, back in the Roman times when the Jews were circumcised, they were able to actually slip and act like they were Roman, slip into the Roman games and act like they were Romans because their circumcisions did not look like they were actually circumcised. And eventually they started removing more of the foreskin because the Jews were beating the Romans in their own games. So, circumcision, it does affect penis size. In 1995, an Australian researcher was measuring the penis size of 150 participants to better understand condom sizing. An unexpected outcome of the research was discovering the difference in size between circumcised and intact erect penises. They found that circumcised penises were an average of 8 millimeters shorter than their intact counterparts. Circumcised, it also meant a reduction in girth of the penis by an average of 2 millimeters behind the cornal ridge and 4 millimeters at the glans. Physical size is not the only thing lost in circumcision. An estimated of 20,000 fine touch nerve endings are lost, along with the rigid band, blood vessels, rolling action of the prepuce, and much more. Above all, the right to a whole body and the ability to have sex as nature intended is forever gone. It also removes the male frenulum, which is the male G-spot. They did a sensitivity study. Who wants to guess the outcome on that one? If you are not cut, you're more sensitive. That does not mean that you are going to be quicker. It just means that you have more feeling and you have more pleasure because you don't have the keratinization and the damage and the removal of all of the functions of the foreskin. Are men happy with being circumcised? Surveys of body image consistently revealed significant dissatisfaction with circumcision. One report suggested that 20% of circumcised men were dissatisfied with their condition, while 18% of them would rather not have been circumcised. Another survey canvassed 197 intact and circumcised American men who reported their perception of their genital condition. Of intact men, 80%, 3%, and 17% were satisfied, dissatisfied, or just didn't care, respectively, with their condition. Of the circumcised men, the respective values were 38, 20, and 41. So you've got 80% versus 38, 3 versus 20. Another report revealed that half of the respondents circumcised and infants were unhappy about it, compared with 3% of uncircumcised respondents who were unhappy being intact. However, the males that are unhappy being intact have the ability to consent to an adult circumcision on their own. The children that were circumcised as infants don't have that option. However, if you were circumcised as an infant, you do have the option to restore. It does replace some of the functions, not all of them, but you will be able to have covering, which can return the mucosal membrane. You will have an increase in sensitivity. You would regain the natural gliding action. And I've got more information on restoration at the table over in Intact Florida in the actual Expo, if anybody is interested in that for themselves or their partner. American women prefer intact. In a landmark study of U.S. women, 85% who had experienced both circumcised and intact men preferred sex with an intact man. Sex with a circumcised man was associated with pain, dryness, and difficulty reaching orgasm. In another study, women were twice as likely to reach orgasm with an intact male. Even when a woman said she preferred a circumcised partner, she had less dryness and discomfort with an intact man. So women that have had issues in the bed and think that there's something wrong with me, if you have a cut partner, chances are it's not something wrong with you at all. It's what his parents chose to do to your sex life. Proxy consent. Proxy consent poses a serious problem for pediatric healthcare providers. Such providers have legal and ethical duties to their child patients to render competent medical care based on what the patient needs, not what someone else expresses. The AAP Committee on Bioethics, it was originally written in 1995 and it was updated in 2012. Routine infant circumcision violates the limits of proxy consent. No disease, no consent, no circumcision. No doctor worth their oath amputates healthy genital tissue from a non-consenting patient. Primum non nocere means first do no harm. Yet again, no disease, no injury, no consent, no circumcision. Doctors that are performing male genital mutilation are 100% violating the Hippocratic Oath of first do no harm. Cognitive dissonance is a feeling of intense discomfort which comes from holding two conflicting thoughts in the mind at the same time, often experienced by parents when they realize what a circumcision really is and they understand what in fact they have done to their child. Educate yourself before you cut, because circumcision is not just a snip. Female genital cutting is a felony in the United States of America. Our 14th Amendment guarantees equal protection for all. Failing to protect our boys from genital cutting or circumcision is un-American, unconstitutional, and technically illegal. In 1997, when they passed this ban, any male that was circumcised without their consent afterwards, coming up this year because they'll be 18, will legally be allowed to sue their doctors and their parents for what was done to them if they are unhappy about it, if they had a botch, if they had complications, if they didn't want their parents interfering in their sex life or their doctor interfering in their sex life. There are circumcision lawyers. There have already been cases, and the males have come out on top. The males have won their lawsuits. If this was a girl, cutting off part of her genitals is almost universally considered to be a mutilation and a violation of human rights. But if it's a boy, cutting off a part of his genitals is commonly seen as an acceptable choice for his parents to make for him. It is not a family penis. Nobody has penis matching parties after dinner. And I know that sounds kind of funny, but as females, we don't compare our breasts or our vulvas or our vaginas with our daughters. We don't expect them to come out with large breasts, small breasts, extra skin, not extra skin. So why do we put these same stipulations on our males? Circumcision is 100% a human rights violation, and every person deserves genital integrity and the right to a whole body. National medical position stances on circumcision. Finland, as I said before, has a 0% rate. 1 in 1,667 men, 16,667 men will require an actual circumcision. And they say there are no medical reasons to perform circumcision on healthy infants. Circumcision is not a disease treatment or health promotion and is therefore not part of Finnish healthcare system. Holland, non-therapeutic circumcision of male minors is a violation of children's rights to autonomy and physical integrity. Circumcision can cause complications, bleeding, infection, urethral stricture, and panic attacks are particularly common. KNMG is therefore urging a strong policy to different circumcision. United States, a physician performing circumcision for other than medical reasons on a non-consenting patient raises ethical concerns. And that's from American Academy of Family Physicians. India. There is no medical justification for routine circumcision in neonates or children. It should be performed and only for established medical reasons and should not be universally recommended. And that's Indian Journal, Sexuality of Transmitted Diseases. United Kingdom. It is now widely accepted, including by the BMA, that circumcision has medical and physiological risks. Parental preference does not parental preference alone is not sufficient justification for performing a surgical procedure on a child. Australia, the foreskin has function role, is non-therapeutic, and the infant is unable to consent. After reviewing the current available evidence, the RACP believes that the frequency of disease modifiable by circumcision and the complication rates of circumcision do not warrant routine infant circumcision in Australia and New Zealand. Canada, circumcision performed on a healthy infant is considered non-therapeutic and medically unnecessary intervention. Circumcision is painful and puts the patient at risk for complications ranging from minor, as local infections, to more serious, as injury to the penis, medical stenosis, metal stenosis, urinary retention, urinary tract infection, and rarely hemorrhaging leading to death. Routine infant circumcision is not recommended, the College of Physicians and Surgical of British Columbia. The CPS does not recommend routine infant circumcision for newborn boys. Many pediatricians no longer even perform circumcisions. The United States, again, health benefits are not great enough to recommend outline routine circumcision for all male newborns, and that's the AAP newest stance, which was just revised, and you have to really dig into the stance to find that, because they are coming out saying that there may be benefits. I'd like to point out that none of these other medical organizations, you have to pay dues to be a member to. So the AAP is protecting their doctors that are performing this procedure pocketbooks, not your children. This is 10,000 dots. Only one adult American male will choose to be circumcised as an adult. Yet we continue to cut half of our baby boys. Something is wrong with that picture. And actually, it's down from that. It's actually at between 32 and 36%. Infant circumcision increases the rates of breastfeeding problems. There's latching complications, ineffective nursing, which reduces your milk supply, discomfort, pain, and crying or colic, PTSD symptoms, a failure to thrive, confusion, withdrawal, agitation at the breast, sleep troubles, night terrors, and insecure attachment. Because as a mother, you just handed your perfect child over to be strapped down and cut with no anesthesia. The early months of life are a critical time for a newborn to develop secure attachment. Physical pain and trauma interfere with the bonding process between a mom and baby. Through the 1980s, the La Leche League International cautioned about the detrimental effect on circumcision can have on breastfeeding. Today, 68% of parents and 91% of Canadian parents keep their sons intact. These are two of the little Nursette bottles that you first start pumping into. The first one shows 1 ounce. The other one is 2.3. The first one is the amount of blood to be considered a hemorrhage. The second one is the amount of blood that it'll take for your child to die from that hemorrhage. They put both of these, it's kind of blurry. They put both of these in a diaper. Even the 2.3 ounces, if the child had urinated, if you go to do like the squish test, it won't come up squishy. So you don't have any idea how much blood your child is actually losing post-op, and the chances of them bleeding out and dying without you even knowing are very high. He's so beautiful, he's so perfect. Now that you've met him and fallen in love with him, can you imagine a piece of his body sitting in the trash, if it makes it there? A lot of the times hospitals will take the foreskin, they'll sell it. They put it in facial creams. They put it in other stuff. It's $595 an ounce to purchase. The man doesn't get the money from that. The parents don't get the money from that. It's the doctors getting paid to harm your child, and then it's the doctors making profit from selling the skin. Before a male knows he's got a foreskin to protect, a mother knows she has a baby to protect. This is from Marilyn Faye Mirlos, who's actually a regret mom. She watched one of her boys be cut, and she said, "Oh my goodness, what did I just consent to?" When are our kids perfect? No matter what they're born with, if it's a heart defect, if it's a clubbed foot, if it's one arm, even if it's things such as, oral tubal defects. When are they perfect? And why are you going to put your child through something to push your own preference, possibly, onto your child? Why are we allowing our NICU babies, our 25-weekers who have literally fought every single day to just breathe, to just have a heartbeat, to just live? Why are we allowing them to be cut for a cosmetic procedure when they've had to fight their entire life to live? At what point do we say stop? What point do we say, no, this is enough, we can't do this to our children? Please learn the facts about circumcision today. These are some really good websites: nocirc.org, generalautonomy.org, intactamerica.org, intactnews.org, thewholenetwork.org, drmama.org. We also have an Intact Florida Facebook page. There's an Intact Tampa Facebook group that I help admin. There's a couple other admins. It's something that people feel is necessary, but after you look at the risks and that there are no benefits, you realize that this is America's dirty little secret, and that as parents, we have to put a stop to this. Any questions? Any comments, any thoughts, any brain picking you guys want to do? One of the things that I didn't go over was how you always hear, well, I want my son to look like me. I want to match. I want to, I want them to have this procedure done. It takes the strongest father to put their foot down and stop the cycle of abuse, to say, no, I will not allow this to happen to my child. Females have a foreskin. We enjoy sex as nature intended it. Males deserve that same. Thank you, guys.